Welcome again, Sqadians. Our topic of discussion today is acute inflammation. You must have heard the term inflammation many times, so this video is going to provide you in-depth knowledge about what is inflammation, its definition, key signs and stimuli of inflammation, different types of inflammation and differences between them, and we will differentiate between acute and chronic inflammation. And lastly, we will try to understand detailed mechanism of inflammation, including its vascular events, cellular events, and then the possible outcomes of acute inflammation. So, without any delay, let's dive in. We know very well that first line of defense are the primary physical and chemical barriers of the body that microbes encounter. When a microbe breaches and enters host body, immune system of that host start fighting with that pathogen unless it gets completely killed or become harmless. Here, one of the immune response generated by immune system against that invader is inflammation. Although sometimes it becomes hard to characterize it under good immune response, as it can cause even more damage sometimes. But still, inflammation is very important immune response. Let's look at its definition. Inflammation is a non-specific host defense mechanism that combats infection by all the means at its disposal. Other than infection, it also responds to any type of tissue damage or injury and resolves or repairs it. Clinically, it is characterized by 4 typical signs. These clinical signs, derived from Latin, are calor, means heat; dolor, means pain; rubor, means redness; and tumor, means swelling. Sometimes it leads to 5th sign as well, that is, functio lesa, that is loss of function. This loss of function in inflammation is temporary, and it can be due to pain or swelling. Examples of a loss of function include not being able to move an inflamed joint properly, having almost no sense of smell during a cold, or finding it more difficult to breathe during respiratory tract inflammation or bronchitis. Histological examination of inflammation suggests the presence of edema, that is fluid accumulation at the site of inflammation, and the infiltration of tissues by white blood cells. Here, the type of white cells involved are neutrophils, macrophages, eosinophils, or types of lymphocytes, like T or B lymphocytes, vary with each type of inflammation. So we can say, inflammation is a normal response of the body to protect tissues from infection, injury, or disease. It shows that there must be some stimuli that triggers inflammatory responses. So, let's look at the causes of inflammation or stimuli that can generate inflammatory response. These stimuli can be numerous, like burns, physical injury, toxins, or trauma, disease, or a medical condition, etc. But most inflammation is a response to the infection by any pathogen or microbe. So, these stimuli, and thus the intensity of inflammatory responses, may vary. But the main goal of inflammation is to restore balance. So this was all about the general introduction of inflammation.